Hello. Join Jarrad Packard of the Urban Indigenous Collective, a social service agency that serves the Native community of New York City and the tri-state area, in a conversational check-in with Safe Harbors New York City's ensemble member, Nic Billey. Please subscribe to our YouTube channel for future installments of 500 Years and Counting, a virtual series.
Hello, everyone. I'm Nic Billey. I am Choctaw, Muskogee, Delaware, and I am an ensemble member of Safe Harbors New York City. I want to thank you for joining me today for Safe Harbors New York City 500 Years and Counting virtual check-in series. Today, Safe Harbors New York City, this brief check-in chat will be with Jarrad Packard of Urban Indigenous Collective. However, I would like to begin this session with a brief thought for myself and on behalf of Safe Harbors New York City. I have and continue to participate in the protest marches, most recently last night. And as an older Native person protesting with the younger diverse protesters, it has been an amazing and very necessary experience through which I continue to learn from this time of change and from the diverse young ones. I would also like to say this, if I can say it correctly. That is the Choctaw way to say, Black people, their lives are sacred. Safe Harbors New York City stands in solidarity besides Black Lives Matter because Black lives are sacred. I also wanted to give you just a little bit of information about Safe Harbors New York City. We are a Native theater company that creates, presents, and promotes Native specific theater, performance work, training, education, and activism. Now, although Safe Harbors New York City is not a social service organization, it is an organization that is from and highly reflective of urban and rural Native communities. With that, to begin this check-in, I would like to introduce Jarrad Packard, and he currently works with Urban Indigenous Collective, and I would like to let him introduce himself and the Urban Indigenous Collective. Go ahead, Jarrad.
Hi, thank you, Nic. First of all, thank you so much for having me here today. I'm very excited to, first of all, I was excited to collaborate with your organization. It's been really fun working with you all and volunteering and coming to your events and seeing your performances. So I just want to thank you for asking me to be here today. I'm originally from South Dakota, and I'm Yankton and Oglala Sioux, and I've lived in New York City for about 2 years now. And about last September, my friend Sutton King and I started, my friend Sutton King, Noel Altaha, as well as Ariel Richer, started the Urban Indigenous Collective. And our main primary focus is to do mental health services for the urban Native American Indigenous peoples who live in the tri-state area. I'm the Director of Strategic Partnerships, and I'm also a second year, now going on this fall, second year social work student at Hunter College.
Yes, yes, thank you. And we are so pleased that you and the Urban Indigenous Collective are collaborating with us in a lot of different ways. You know, because Safe Harbors New York City is about community, the Native community, both rural and urban, and because we come from everywhere. So, Jarrad, what are a few of your thoughts about how COVID-19 is currently impacting Native communities, both rural and urban? Could you briefly discuss the difference between being a rural and urban Native person as well?
Yes. Well, first of all, I think the difference between being rural and urban. So for me, for example, I grew up in South Dakota, and I was born in Pine Ridge, but I grew up in Rapid City. And so even that in and of itself was sort of like an urban and rural divide, because Rapid City, even though it's a small town, about 60, 70,000 people, you know, it is, you know, it's a city, it's not the reservation, and you know, there's grocery stores, you have like access to a lot of things that are very close by. And then in contrast, you think about rural populations, and you drive down to Pine Ridge, it's 100 miles, it takes about 2 hours. And, you know, there's one stoplight in the town, there's like one grocery store, there's like 2 convenience stores that, you know, provide gas, as well as just like, you know, like not concessions, but just like snacks and different things like that. And, you know, it's pretty spread out. It's rural. You know, your neighbor is not like right next door to you. If you live in Pine Ridge, they are, but if not, you know, they're far away. Well, the point is though that like, you know, it's a different life experience. Yes. In terms of COVID, the experience for urban natives and for people who live in rural areas, you know, we already know the infection rates, you know, across all of the United States. If you were to take the top 5 tribes that currently have infection rates or case rates, they would actually be the top 5 states per capita. So that would be the Mississippi Band of Choctaw Indians, White Mountain Apache would be 2nd, Pueblo of Zia would be 3rd, Pueblo of San Felipe would be 4th, and then the Navajo Nation would be 5th. So those reservations themselves actually have higher rates of COVID than New York State, which is actually the highest state at this point. So, I mean, just in terms of like those communities out west, they're experiencing COVID at a much higher rate and you know, having a much larger impact on their communities than places like New York and, you know, other states that are experiencing COVID. Mm-hmm. And even that is in and of itself is an issue in terms of reporting, because you have the issue where a lot of states, they don't, you know, the states are the ones who are, I think, in charge of the census and kind of keeping track of those different epidemiological statistics. So like morbidity, mortality, incidence, you know, those types of things. And when you look at those statistics, a lot of those places, you know, 80% of the places that are taking race and ethnicity statistics, only half of those are actually check marking, you know, American Indian or Alaska Native. And then so half of those have it either an other box or they're just not checking them at all. Mm-hmm. So you have this huge issue in terms of like systemically, in terms of census data and tracking that's, you know, just not there. So those numbers probably are, you know, are underreported. Yeah. So you already have high rates in certain areas and they're probably underreported. Those two are pretty exacerbated. And then when you think about living in an urban area, you know, according to NCUI, which is the National Council of Urban Indian Health, urban Indians are 3 times more likely to live in poverty, be uninsured, and have diabetes than non-Hispanic whites, which is the terminology that they use in those statistics. And they're also 1.5 times more likely to have coronary heart disease, live in multi-family rentals, and be hospitalized for asthma and respiratory infections. So you have these, you know, comorbidities that, you know, we already know in terms of COVID-19 that having comorbidities, having diabetes, you know, those exacerbate the complications and, you know, that are related to people who experience COVID worse, and also from people who've been dying from it. So just those statistics alone, and I think health disparities in general kind of paint a picture that's relatively bleak, I think, for both rural and urban Native communities.
That's really important. Thank you for sharing that. I really appreciate all of that statistical information. People just don't realize that there are not a lot of resources that, whether it's urban or rural, Native people don't have. You pointed it out very profoundly. However, we're in an urban setting, and we tend to have running water, we tend to have electricity, we tend to have the internet available on hand. Like this is, you know, we're doing this right now, it's available to us. Could you just expand a little bit more on what resources that rural and even a lot of urban Native people don't have?
Right. So kind of like what I was saying before, I mean, specifically in rural areas, you have a lot of natives that live kind of remote areas. A lot of places, especially I know when I was in the Southwest, when I was in high school, we went with this family to get water, and they had water, and it was in the back of their truck. And I have a friend who also lives out there, and I was talking to her on the phone recently, and she mentioned, she's like, oh yeah, we gotta go get water. And so it's not something that everybody's, you think that like, oh, we live in the 21st century, everybody has access to water, they have electricity, but a lot of reservations or a lot of people that live in rural regions, they don't actually have that.
Yes.
And so you have, what are the things that are helping people to prevent coronavirus? Washing your hands. That's like you constantly hear, that's the main thing, like wash your hands, basic treat for people. Another thing to mention is a lot of people live in multi-generational homes.
Yes.
So you have the grandma, you have your, the parents, you have the grandchildren, and then even babies, even infants. So you have sometimes up to 4 generations that live inside of one dwelling, and in sort of I don't want to say tight conditions, but like just a lot of people living in one house. So that's the other thing is like how are these people going to socially distance whenever there's like 10 or 15 people living in one house? That's one of the things that, is important in terms of coronavirus, is just like being able to maintain distance and isolate. Well, you're not going to be able to isolate if you live with a bunch of your relatives. And so I think that's something too that if people don't know, that's the experience, and those are the issues that are sort of exacerbating COVID-19.
So Jarrad, I would like to expand this conversation just a little further. What are your thoughts about how COVID-19 has impacted Brown, Black, and people of color communities?
Yeah, so we know that I think because of some of the issues that I talked about earlier, specifically as it relates to both rural and urban natives, poverty is a major factor. Not having health insurance, that's another major factor. So I think those two things specifically have a huge impact on, I guess, how COVID-19 has spread through the community, and how it specifically has disproportionately impacted, communities of, Black and Brown communities, Native American communities. And, when you think about I was in school this past semester, so one of the classes that we read were talked about race and health disparities. And, there are already health disparities, major health disparities in the United States when it comes to various, life expectancy. When you think about, different rates of diseases, HIV, you think about influenza, how it impacts people, so there's already in our system that we have these huge disparities between minority communities and non-Hispanic whites, as they call it. And so I think that's something that, this COVID-19 has exacerbated. So we already knew that people had, these sort of risk factors that were already in place because of lack of education, because of lack of, I guess, like access to employment. I mean, employment is a huge thing as well. And, a lot of people get their health insurance through their employers. So if you don't have health insurance, how are you going to go to the clinic? I didn't have health insurance myself. And I was feeling sick, and I called one of the clinics, and they were like, well, how are you expecting to pay for this? And I was like, I mean, aren't you a state clinic? Like, don't you offer, you still won't just see me? And she was like, no, you need to call the main hospital. And I was like, all right, whatever. But, so I think that there's like things like that happening in our communities of color, that because of there's already this sort of systemic issues with regards to race and to just like access to resources, as well as health disparities in general. COVID-19 is just like showing them and bringing those issues to light even more.
We've also been hearing about a second wave of COVID-19. Now, do you think that this is an inevitable occurrence? And how should we, the New York City Native community, begin to prepare for a second surge?
Yeah, so I mean, when you look back at the history, you know, everybody's sort of, if you hear on the news, people talking about the Spanish flu of I think it was 1919, and you know, in that pandemic, there was the initial wave that hit in the spring, and then in the fall there was a large second wave that was actually even more deadly than the first wave.
Mm-hmm.
And so, you know, my thinking is that, you know, we should look to history to really see kind of how diseases and how viruses really impact communities. I don't think that we're all that different in terms of, like, you know, how we, you know, navigate cities, how we communicate with each other, you know, how we conduct business, how, you know, schools, education systems, all these systems are kind of, you know, put us into close contact with one another. So I think that there is a way for us, because we have technology, to sort of help reduce the impact of a second wave. I do think a second wave is inevitable. I do think that will happen. But I do think that there are ways for us, you know, people in general, but Native communities, you know, one of the things that I would encourage to continue doing is to continue social distancing, you know, staying with select groups of people, staying with your family, not venturing out too often. I think especially now as things, you know, as it's summertime and people want to go outside, you know, maybe go to parks, go to places where there's not a ton of people, but always maintain distance between people. So, you know, continuing to kind of remain vigilant, if you will, about, you know, any sort of actions that you've already been taking, you know, kind of accepting this as a new normal and continuing to incorporate this into how you go about your day. I think also, if possible, if you have the ability to work from home, to, you know, ask your employer if that's a possibility for you to continue working from home, just because, you know, I think that there's ways that, you know, employers can support employees and provide them with either laptops or, you know, whenever I was on my internship, we had a laptop, we had a phone, we had a Wi-Fi. And so we were able to continue conducting business. And I think that's something that, you know, if you're able to ask that of your employer, continue obviously practicing safe hygiene, washing your hands, removing your clothes when you return home, just remaining vigilant in that. We'll continue wearing a mask. If you're sick even and you're outdoors, it helps you to prevent the spread as well. And then also, if you don't have health insurance, going to the New York State of Health and signing up for that, or contacting an MCO, managed care organization that's Medicaid through the New York State, and seeing if there's a way for them to help you sign up. I actually ended up getting health insurance myself through that method, through going through an MCO, and it was very quick. I called them up, they called me back, and then I was able to get insurance pretty much almost immediately.
That's really important to know. But I also think that, and possibly you're on the same page, is that if available, depending on where Native people are located, to encourage, if they can, depending on their individual and communal resources, to be tested for the virus and for the antibodies. Would you agree with that, or? Yeah.
I mean, I think if you're, you have access to getting tested and you think that you might have had it and you want to check for antibodies, you know, there's ways that you can contact, you know, reaching out to your healthcare provider and seeing if they offer that local clinic, looking online to see where there are testing places, and calling them up and taking action to do that. I'm aware that there is going to be a second wave coming, and so it is hard to kind of be disciplined and to continue social distancing, to continue to making sure that you're staying at home and you're not practicing, you know, going out and meeting and hanging out with all your friends, because I think that that second wave will be a result of taking those actions.
Yes.
And so, you know,
once you've completed the requirements for your MSW, the Master of Social Work, how do you envision utilizing this very, very important degree?
Yes, so my vision, my goal is, you know, continuing to work with the Urban Indigenous Collective. You know, I think we want, because we've been open less than a year, you know, we're still kind of trying to figure out, you know, strategies and ways. I mean, and COVID has had a huge impact sort of on our, you know, the plan that we had laid out for ourselves for this first year. One of the things that we wanted to do was to have a community forum to really have an opportunity to engage with the community in a way where we could develop our programming that was centered in community voice. And so COVID-19, our community forum was scheduled to take place in mid-March, but because of everything that was happening during that time, we canceled it. Like as many other events, organizations were canceling all of the things that they had scheduled. And so, I think for us, re-engaging the community at some point and continuing to get that community feedback so that we can, work on our programming. And for me, I would love to have an opportunity to provide mental health services, to get my LMSW, take the licensure, get that LMSW. I think we're also in the process of trying to find a clinical social worker so that we can actually provide those services. So there's just a lot of building that we're going to continue doing. I think at one point having a clinic where people can come in, Native people can come in and get services, talk about issues, if there's experiencing issues, anything that they may be experiencing mental health related, coming in and getting those services from us.
Take a little twist in a different direction right now. I want to reiterate something that I began with, and this totally involves you, because I just want to reiterate that Safe Harbors New York City is a Native theater company that does create, presents, and promotes Native specific theater performance work, training, education, and activism. It's not a social service organization. And I also want to provide this information to those that are watching, is that it's about Safe Harbor's most recent endeavor here in New York City for Native theater. It was Safe Harbors New York City presented Reflections of Native Voices. That was held January 7th through the 19th, 2020. It was a 2-week festival of Native playwrights, actors, producers, directors, and song makers. Now, the festival was the first of its kind in New York City and was presented through the lenses of creative expression and cultural perseverance. And the Native performing artist explored original Native material in a cultural exchange involving new plays, directing, workshops, and song making. These performances and workshops were held at La Mama Experimental Theater, New York Theater Workshop, Theater for the New City, and the Carriage House. Now, you and the Urban Indigenous Collective have worked closely with Safe Harbors New York City, and you've also witnessed a number of our performances. Could you briefly describe in what capacity you and the Urban Indigenous Collective have participated with and in Safe Harbors New York City events?
Yeah, so I think, first of all, we're really grateful for this partnership. I mean, obviously, Safe Harbors has sort of, I don't know what you would call it. I guess you really have been able to kind of bring the community together. I haven't been here but for 2 years. And so to see that, at your winter social where we were tabling and to have the opportunity to meet a lot of the Native community members was really major for us. And so I think, that specifically was a huge, huge event. Kevin as well as Muriel presented and introduced us, which was really fabulous. And we sort of was our sort of like entry into sort of our first opportunity, other than the Indigenous Peoples Day, the opportunity to kind of meet and greet a lot of the Native community. So that was a really huge event for us. We were really grateful for that. In addition to that, when you had the Native Voices, Reflection on Native Voices, that was really an opportunity for me specifically to meet a lot of the people that were in the art world and in the Native community art, performance art space, and really get a chance to talk to people, get to know them. And, I think just have an opportunity also to watch the performance. I think the performance, the first performance, the opening performance of the Hawaiian, all the people that came from Hawaii, I mean, that was really, really moving for me to see. The fact that they did it in their native language, the fact that it was about a historical event, and it was all, I don't know, it was so moving to me because you could really, despite the fact that I don't speak that language, the pain, the emotion, all of that sort of, you know, I still felt it. You know, it was such a powerful, I mean, there wasn't a way that you couldn't not connect to that, I feel. And so, you know, that was really, I guess, you know, a powerful experience for me. And it opened my eyes. I'm not a huge performing arts person. I don't go to plays. I don't go to theater. I love movies. But I mean, for me, you know, going to see performances is not something that I do regularly. So to have the opportunity to do that was really amazing. And also, like I said, it just helped me to get to know a lot of the community members. And also, I love fundraising. So it was fun for me to stand out and talk to people and try to, you know, help support you all in fundraising. And then, you know, I think just in the most recently at the Armory, when we had our opportunity to have the panel, that was really wonderful. And, you know, I'm sort of new in my career too. So I think for me, it was personally special because I don't get asked to do things like that very often. So it's nice to be given an opportunity to speak about our organization, to speak about mental health, Indigenous communities, the New York City and the tri-state area Native community, and you know, really help to, I guess, get our names, the organization out there, but also to support you. And like you said, you guys are more performing arts, we're more health and wellness related. So there is, I think, a way for us to meld those two worlds together through performance. I think, you know, in terms of collaboration in the future, I'm looking forward to, you know, I would love to see a play or some sort of performance that had to do with health disparities. I mean, you know, this is something that I've studied since I was an undergrad in DC, and I think for me, you know, the issue that these health disparities continue to exist, and I think there's a way that performance can address those, but also performance itself is a protective factor. You know, you think about the cultural ties that you know brings us, that especially with regards to that Native organization that did their performance. You know, their young people are learning their language, or they're, you know, learning how to sound it out. They're learning to not only sound it out, but how to perform it. They're learning about the history. So there was so much in that one performance, I feel, that really spoke to the protective factors as it relates to young people and mental health, that I think is, you know, there's a huge opportunity there to really engage young people in a way, and not even just young people, everybody, and, you know, that are performers in a way that connects us back to where we come from, to connect us to our roots and our heritage, to our language, to our history, and to the issues that we face today. And you know, I don't know, there's just something about that I think that's really, there's a huge opportunity for us to collaborate and to kind of work on those issues and help come to some sort of, to develop some sort of, I don't know if it's a curriculum or if it's a specific play or whatever that, I guess, helps us to work and collaborate and focus on those issues and help improve them.
Yes. Well, I must say that during the panel at the Armory this past February, having your presence there, having your knowledge and what you presented was very impactful. And it also was very, it intersected with the arts. And in its own way, it is a performance. So you were very impactful and very inspiring during that as well, because because Safe Harbors New York City doesn't necessarily see your organization as separate. You know, you are us, we are you. We do reflect each other. And just as you've been saying, is that we use that word collaborate, but we're just interacting with each other, and it's been a good collaboration because we're learning from you. And just as you said, that performance can be its own, for lack of better words, method of healing. You know, it can do prevention, interventions. It can provide an array of resources as well, whether it's, you know, internal, external. It provides a sense of community. So you are community. Your organization is community. Your organization is like Safe Harbors of New York City. So I am so grateful that you are you're partnered with us. I so agree with you. And you touched on something very important, that it's important for us as Native Indigenous peoples to present our own descriptions, our own thoughts, our own narratives that is generated by us, for us, to us. And it's important for us to see each other, to be reflected within that, whether it's performance, whether it's greeting you at a table, at a tabling or an event. It's important for us to see each other because we don't get to see that often. And our stories are often told about us, for us,
Yeah.
and we seldom get to do it. And when we do get to tell those stories, regardless of whether it's in theater or in mental health or in other ways, we're always questioned. Is it real? Do you, like we were talking about earlier about the resources? A lot of people don't realize that Native people don't have the resources, and many people still live in this, live with this fantasy that you and I have health care. We don't pay taxes. We get everything for free. And that's not true, because you just dispel that myth by stating that you had to get health insurance in order to take care of yourself. So I'm grateful that you are a resourceful Native person. So Jarrad, this comes to the end of this check-in session. And I want to thank you so very much. I want to thank Urban Indigenous Collective so very much as well for being here, for being present, for diligently serving the New York Native community, even though you're a young organization, even though you don't have funding. That's amazing that you're doing this. So I encourage you to do it. You have a place here with Safe Harbors New York City. And I want to thank you for taking time out of your busy life to engage in this conversation with me. And thank you so much.
Yeah, thank you. I want to say thank you as well. And, I think me, and I speak for everybody on the team, we owe you all a huge, we have a huge sense of gratitude and appreciation for your organization too, just because, I think that you guys have really provided us with that initial platform to go out there and actually meet and greet the community. So I want to thank you all for that. And, I look forward to continuing to collaborate and to work with you and see you at events and to continue to do this work, because I think it's really, really needed here in this community. And, I think partnering with an organization like Safe Harbors allows us to continue to get out there, to get the word out, and just really to provide, continue providing services. Like you said, we do hope to be funded, in the coming year, fingers crossed, we're applying for different things. So I'm hopeful that, as time goes on, this collaboration will only continue to grow. So thank you.
Thank you. So just in brief remembrance, I would like to just mention the names of the individuals, the Native peoples within Safe Harbors, New York City. Muriel, Josie, Danielle, John Scott, Steve Peace Smith, Sam, and Kevin Tarrant. I would like to also invite you to join Safe Harbors New York City 500 Years and Counting, our virtual series, for our next virtual check-in, which will be with Sharon Day and Curtis Kirby of Minneapolis. We will also have a performance by the brilliant and historied dance company, Forces of Nature. Again, I want to thank Jarrad Packard and the Urban Indigenous Collective of New York City for taking this time to chat with me and to provide us with so much invaluable information. And they are an invaluable part of the Native community of New York City. Thank you, and I'll see you soon.
Thank you. Thank you, you too.